everyone. Today, Mayor Demings met with the constitutional officers here in the county and other officials regarding our continued discussion surrounding the coronavirus and its impact here locally in Orange County and in Central Florida. Mayor Demings will give us a briefing regarding that conversation today. Joining us here is Chief Judge Myers is here, Sheriff John Mina, Dr. Martinez from our health department, Dr. Pino from the state. We have Commissioner Myra Uribe is here. We have Mark Tester from the Orange County Convention Center, Commissioner Gomez Cordero, Commissioner Christine Moore, our property appraiser Rick Singh, and who is behind me here, Comptroller Phil Diamond. I think that's everyone here on stage. Mayor Demings will give us an update now on the briefing that he had with all the constitutional officers and others regarding the coronavirus here locally. Mayor Demings.
All right, thank you. Let me first begin by saying I appreciate the media being here to receive this update. We will give you an update on the current state of affairs regarding COVID-19 or the coronavirus here within Orange County. We want our residents to be reassured that they will be fully informed about what is happening here in Orange County. Let me emphasize that we remain at a low risk of a major outbreak of the COVID-19 virus in our community. We invite families and others to consider vacationing here, especially during spring break. We are still open for business here in Orange County. Just a few moments ago, we concluded a meeting amongst the department heads within Orange County as well as our constitutional officers to make certain that we are as well prepared as possible to keep our community safe if we see any type of outbreak here in the community. It is important to note that there are no known coronavirus cases in Orange County, and that's really good news for us. In the entire state of Florida, there are only 4 cases of residents who have tested positive. The latest case in St. Rosa County involves a man who is in his 70s. St. Rosa County, of course, is north of us in the Panhandle. On Monday, we told you that the Tampa Bay area had residents who tested positive, and a Manatee County resident also has since tested positive. When we look at the economic impact of what is occurring, not just here, but across the country, we have not gone unscathed in that process. At our convention center, one major conference was canceled today. The Health Information Management System Society, or HIMSS, informed us that their global health conference has been called off. This is a huge hit, really, to Orange County and the convention center. HIMSS was expected to draw 43,000 attendees. The HIMSS conference would have meant 94,530 room nights for our hotels, and its economic impact would have been $113 million. Earlier in the week, the software company Illusion, with 8,500 attendees, canceled a show here at the convention center. The Minecraft Festival with 15,000 attendees also canceled an event. We believe that most of this was the result of the coronavirus outbreak. When we look at the 2, Illusion and Minecraft, that alone was $41 million. So if you do the math, we lost roughly $154 million in potential economic impact just this week alone. But there's more good news, because our leisure travelers continue to come to Orange County to enjoy our theme parks and all that we have to offer. Visit Orlando reports that the virus had no impact on leisure travel. As far as international travel, if you look at visitors from China, South Korea, Italy, and Japan, countries where there have been cases of coronavirus, it represents only 0.3% of the 75 million visitors who come to Orange County. Again, that's 0.3%, 0.3%. We want to emphasize in Orange County, we are open for business, and the risk, again, remains low for our community. We want to keep emphasizing that while the coronavirus moves at a fast pace, we are remaining calm in this community and have been working with our partners at the Florida Department of Health. I will also tell you that we're taking measured approaches here within Orange County. A directive will go out this afternoon to all county employees that we are canceling travel for employees on county business into the high-risk areas. I think it makes sense, especially with our first responders, that we don't send them on government business into high-risk areas. So we are canceling travel there. In terms of our other county employees who will travel for personal reasons, if they go into the high-risk areas, we're going to give them directions. In terms of returning to work, we want to ensure that our workspace continues to be a safe place for us to deliver services to our community. At this time, I'm going to ask Dr. Pino to come forward and provide an update to you from the Department of Health. Dr. Pino.
Thank you, Mayor. Good afternoon. As the Mayor said, our risk continue to be very low. From a public health standpoint of view, we don't foresee today, under the current conditions, to have any concerns for our community. We continue to prepare, and we are moving under the direction of the State Health Department, our Surgeon General, to a new phase, and we will be ready soon to expand testing into our community to people in need to be tested. Those will be the next steps for us to take. As we test more individuals, there is a possibility that we could find a positive case in our community, and for that we are also ready. We have trained for this and prepared for this through the many epidemics that we have in the past. I would like to remind the public that we dealt with Ebola, we dealt with MERS, we dealt with SARS, and we were always prepared and always find a solution for the problems that have faced us. In this new phase, what is concerning to the community and also to us is that we don't know everything about the virus. But not knowing doesn't mean that we are not prepared to intervene, to extract individuals from communities or hotels that need to be isolated, and also to have all the measurements in place to protect the public at large. Thank you.
At this time, I'm going to ask Dr. Yolanda Martinez, who is the Director of our Health Services, to come forward.
Thank you, Mayor. Good afternoon. I just wanted to give a brief update from the Health Services Department at Orange County Government and put everybody at ease, just as the Mayor and Dr. Pino has been saying, that we have been working on this through the Health Services Department and our emergency medical services. Dr. Suver, our emergency medical director, has been since early January in conversation with the hospitals and other community partners to make sure that we are prepared to address any cases in our community, whether from travelers through the health department and or residents. So we want to make everybody assured and confident that we are working on this and we're making sure that the health of the community is safe. One of the things we want to remind everybody is about safe distancing. If you encounter an individual that has symptoms of the flu, please keep your distance from that person, and that person the same if you don't feel well, if you feel sick. Do not come too close to other individuals. Make sure you engage in good hygiene by washing your hands at least 20 seconds and rinsing them well and then drying them well. And if you feel that you do have the flu, contact your medical provider before you head to their office and or to the hospital. It's always better to try to treat it at home. So stay home if you feel sick, unless you feel that you do need medical attention. And those are some of the comments that we wanted to share. We've been working, as Dr. Pino and the Mayor mentioned, with the Health Department. The Health Department is leading the role in the county to make sure that they identify individuals that might come down with COVID-19. Thank you.
Okay, as you can see, this is really a team effort here. While we don't have any cases now within Orange County, we really endeavor to keep it that way. And by working across the spectrum here in the public sector, we are able to hopefully deliver on that. At this time, I will open it up to any questions that the media may have. At this time, if there are any questions, we'll respond to them.
Monitor monitor any more people here in the county?
Okay, the question is, are we monitoring any additional people within Orange County? Dr. Pino is best to handle that.
So the numbers have not changed. It continued to be very low. The state also have put up in their webpage for the health department, it has a total count for the state, the number of residents from Florida that has been diagnosed, and also the number of residents of Florida that are being diagnosed out of Florida. We have a couple of residents that are in one of the affected states. And they also have the number of people who have been tested and the pending number of tests. But our number have not changed, they remain very low.
How many are we currently monitoring?
Because the numbers are so low, we are now in no position to disclose those numbers for fear of interfering with people's privacy. So with that, but that remains very similar.
How soon do we see CDC test kits here?
So I need to clarify that. So there are two components to any test. When the sample is collected, and we have that, we are ready to do that if we need to. And then the reactive agents that are used by the labs to prepare the samples. Those are the ones that the CDC is distributing around the nation. I don't have information on that, but it is expected, for what I read in the national news, that in a few weeks, tests will be available in commercial labs as well.
At this point, those are the only ones that have made that final decision, but we'll be monitoring this, obviously. I believe that one of the motivating factors for those which have canceled is, especially those who are associated with the healthcare industry, they believe that they're on the front line, and they are certainly very pivotal to our potential response as a nation and really globally to the COVID-19 virus itself. And so they believe that they were at a disproportionate risk. And so I certainly understand that, which is part of the reason why we have said that internal to the county, we are canceling any travel for our employees who will be traveling on business to any of those high-risk areas, especially the first responders, those in EMS, et cetera, who have the direct contact with people who may be presenting symptoms. So with that said, we hope for the best as we move forward, and we want to be clear that we remain open for business here.
Talk a little bit about the economic impact. You mentioned a number as it relates to how much money the county had lost just this week alone in relation to those events canceling. How big of a blow is this to the county?
Well, it's significant. When we talk about the potential economic impact of $154 million or so on our community, that's really significant to us. And so what we want to do is to make sure we stabilize that, but we certainly understand why certain organizations are taking the precautions that they're taking. Okay. Thank you all very much.
Theme parks to make sure that monitoring is happening there, and those cases, issues are being reported to the county health department, or can answer that question?
Yeah, all of that is being done. We're working very closely with the theme parks and our hoteliers and others in this community to make sure that we have an accurate count. Certainly if people are symptomatic and they enter the healthcare system in any way, those numbers are being captured at this point, and they are being taken care of as appropriate. So the good news again is no new cases. The numbers are relatively low.
Are extra cleanings happening at the convention center, or any other protocols put in place to reassure people who might, still have events down the line and are still maybe debating whether or not they come?
Absolutely. With our clients there at the convention center, we're in constant communication with them these days, and we have done some things to make certain that we have appropriate sanitation dispensers within the convention center itself, and so we're closely monitoring this going forward.
What about sporting events? I mean, there's a big soccer game going on at the stadium tonight.
I think that if we listen to our medical professionals, what they tell us is that the risk of exposure remains low because we don't have any specific cases in our community. So we really have to continue with the precautions, the common sense precautions that you heard Dr. Martinez talk about a few moments ago. We can do our best to make certain that we protect ourselves from just the regular influenza that is out there. And so I think when we give you those common sense guidelines about washing your hands and some other things, that everyone should continue to do that. Okay.
Are there enough test kits, enough tests available to meet the demand of folks who want to be tested?
So from our perspective at the health department, we have a number of kits. So the test is 3 tests that you take. You know, the normal swab of the nose, the mouth, and sputum if the person is have a productive cough. And those are the normal tools that we have when we test for the flu. So there's no shortage of that in the sense that healthcare facilities, we are in flu season, so they are fully staffed for this. We may face an issue later on, and if we continue to order and as tests increase, I'm assuming that production has also kicked up a little bit.
All right. Again, thank you for coming this afternoon. Hopefully this has been informative to you.